Hello, everyone. My name is Mark Zipotzwoli, and I'm the CEO and co-founder of Nuralogix. We are an effective AI company, which is the intersection between effective computing and artificial intelligence. Let me begin by asking this question. What if you could check your health using nothing but your smartphone in just 30 seconds? Our answer to that question is you could check your health in 30 seconds if you had a Nura on your phone. A Nura provides you with a plethora of general health and wellness information in just 30 seconds. Nura is the world's first app to allow for blood pressure measurement using just a selfie video from your smartphone. In addition to blood pressure, Nura provides medical grade accuracy for heart rate, breathing, heart rate variability, cardiac workload, mental stress, body mass index, and cardiovascular disease risks. All of this is then distilled into an overall general wellness score. The current version of Nura increases the user's awareness of stress, hypertension, and cardiovascular disease risks. In addition to that, we are working on new features for future releases, which include blood biomarkers such as A1C, cholesterol, and hemoglobin, mental health indices for anxiety and depression, physical indices like body shape index and waist to height ratio, which will help us to estimate your risk of type 2 diabetes. We have also developed a COVID-19 model in collaboration with St. Michael's Hospital in Toronto, the University of Toronto, and Zhangde Hospital in China. The model will give you a probability of being infected with COVID-19 based on your current symptoms. In addition to Nura, the mobile app, we have developed a Nura Heart Magic Mirror, which we're calling the world's first health appliance. In addition to all the Nura measurements, it will allow you to measure body temperature plus blood oxygen saturation, and much more. It will act as a home health appliance, a telemedicine portal, a health check station, and much, much more. So how does it all work? Facial blood flow data is extracted from a selfie video by the client app, running on a smartphone, tablet, or laptop, using our patented technique called transdermal optical imaging, or TOI. The blood flow data, or TOI signal as we call it, is sent to our cloud-based effective AI engine called DeepFX, which then applies advanced AI models to predict and measure selected physiological and psychological states, what we call points. Results are returned to the client app for display. This is the basis for our SaaS-based revenue model, where the client pays on a per measurement, per user basis based on the number of users and number of measurements. The general market sector we play in is digital health, a market which was $106 billion in 2019 and is projected to grow to $639 billion by 2026. We are currently engaged with 50 plus customers at various stages of evaluation, POCs, and integration of our technology across multiple verticals. These customers range from startups to Fortune 500 companies. We have just started generating recurring revenues and have a rapidly growing sales funnel across multiple verticals. Some specific use cases for healthcare are telemedicine, where our technology is being used to create mobile/home telemedicine platforms with the ability to measure key health parameters such as blood pressure using just the video camera. Corporate wellness, where our technology is being used to monitor the health and wellness of employees for the benefit of improving employee health and productivity and lower healthcare costs for employers. We have a growing patent portfolio with 8 patents currently granted and 6 more pending, the crown jewel being the blood pressure patent for now. We have done multiple rounds of financing since inception, having raised a total of $20 million Canadian. There are no institutional investors in the company. The CEO and co-founder, i.e. me, is the lead investor, having contributed $10 million to date. So you might say I have some serious skin in the game. We plan on doing a Series B in 2021. We're looking for the right partners to help us grow and achieve our goal of helping to improve the lives of people everywhere. We have an experienced management team and with proven track records and strong financial and reputational commitments to the success of the company. It's not our first rodeo, and it's more than just about the money. Thank you.
Wonderful. Marzia, do we have you on the line?
Yep. Hi, Ava.
Hi. So for everyone in the audience, that poll did pop up for you if you'd like an intro. And Marzia, we do have a few questions for you. Can you provide Nura as an SDK for other apps?
Absolutely. That's what we're doing with all our B2B. So we have it as a B2C app for consumers, and then we have a version for B2B applications.
Great. And how accurate are the measurements and how far away from getting FDA or CE approved are you?
Yeah. So they're very accurate. If you want to really know, I have a whole chart going step by step, measurement by measurement. The one that we spent the most time making accurate to what I would say clinical grade or medical grade or FDA accuracy is our blood pressure. And we're now going to embark on trying to get it approved. I think our strategy is to do it with different partners in different regions. So we have a European partner who's going to be actually doing a major announcement tomorrow. I'm so happy. They're also a plug and play corporate partner, Ava, just so you should know. And they're going to they've adopted our blood pressure algorithm into their platform. They own about 5 hospitals. They run about actually 4 hospitals and 25 clinics. So they've already done the proof of concept, vetted it, and now we're going to work with them to get CE marking for it.
Wonderful. And we have time for one more question. Is there a need for a baseline measurement on the patient to determine differences?
No.
Okay.
Not required.
Well, great. Well, that's all the time we have today for questions. So thank you so much again for joining us.